Assalamu alaikum. I am Dr. Khadiza from Bashundhara Ad-din Medical College. Today is the last class of WBC. I am going to discuss about detail about the reticuloendothelial system. Reticuloendothelial system is there is another name, monocyte macrophage system. It is actually the combination of monocyte, mobile macrophage, fixed tissue macrophage, and few specialized endothelial cells. In the bone marrow, liver, spleen, and lymph nodes all is collectively you can call reticuloendothelial system. And usually the monocyte macrophage system are usually formed by the monocytes. The blood monocytes, when enter the tissues, they begin to swell and increase their diameter as much as 5-fold, which can be seen under naked eye. And these cells are now called macrophages. These are capable of combating disease agents. They are usually fixed macrophage or free or mobile macrophages. Tissue macrophages respond more slowly than neutrophil to chemotactic stimuli. They engulf and destroy bacteria such as tubercular bacillus, some fungi, protozoa, dead cells, and foreign matter. The tissue macrophages in various tissues differ in appearance because of environmental differences, and they are known as different names. Like in liver, that is you can call it Kupffer cell, and in the lymph nodes it is called reticular cells. In the bone marrow, osteoclast cell, alveolar macrophage in alveolar cell, alveolar lung, and tissue histiocytes are usually the macrophages in subcutaneous tissue, and microglia in the central nervous system. Line of defense. Tissue macrophages as the first line defense act as a first line defense, and neutrophil that invasion in the inflamed area, and it is known as the second line defense. And monocytes when go to convert to the macrophage invasion to the inflamed tissue, and act as a third line defense. And when increased production of granulocytes and monocytes by the bone marrow, it occurs the fourth line defense. Now, variation in counts. We know that normal count of WBC is about 4,000 to 11,000 per cubic millimeter blood. When any variation of this count is called variation of count. When in leukocytosis, when the blood count, when leukocyte count increases more than 11,000 per cubic millimeter blood, it is called leukocytosis. It can occur in both physiologically or pathologically. This can increase. And now leukopenia means when the total count of leukocyte decreases below 4,000 per cubic meter blood. This term generally used for pathological condition only. Causes of leukocytosis are infection, tissue injury due to infraction, burn and surgery, hemorrhage, neoplasia, inflammatory disorders such as gout, rheumatoid fever. Causes of leukopenia are infection by the bacteria, viral infection usually hepatitis, influenza and rubella, bacterial typhoid fever. Typhoid fever is different from other bacterial infection. Usually leukopenia occurs in typhoid fever, but usually all other bacterial infection leukocytosis occur. And second is the drug megaloblastic anemia, acute leukemia, aplastic anemia, ionizing radiation, cytotoxic drugs. Leukocytes. Now let us know about the critical low value and high values. A WBC of less than 500 places the critical patient at risk for fatal infection, and a WBC over 30,000 indicates massive infection or serious disease such as leukemia. Now let us discuss other conditions like neutropenia. Neutropenia, that is increase in circulating neutrophil count above upper normal count. This is it is commonest of all other leukocytosis. Physiological causes of neutropenia are newborn babies, after exercise, after meal, pregnancy, menstruation and parturition and lactation, mental stress, emotional stress, and after injection of epinephrine. Pathology Pathologic neutrophilia are acute pyogenic bacterial infection, non-infective inflammatory conditions like gout, acute rheumatic fever, burn, postoperatively, and myocardial infractions. Neutropenia, that is when the neutrophil count decreases below the normal. The causes are typhoid and parotid fever, malaria, aplasia of the bone marrow depression due to some drugs like cytotoxic drug, and radiation like X-ray, and chemical poisoning like arsenic. Now, what is eosinophilia? Eosinophilia refers to increase in eosinophil count above the upper normal value. The causes are allergic conditions like bacterial bronchial causes are allergic condition like bronchial asthma and hay fever, parasitic infestations, skin disease like urticaria, scarlet fever. And now what is eosinopenia? Eosinopenia is usually decrease the normal count of eosinophil below the normal. The causes are adenocorticotropic hormone steroid therapy, stressful conditions, and acute pyogenic infections. Now what is basophilia or penia? Basophilia means increase in the basophil count, and basopenia means decrease in basophil count. When basophilia occurs, its causes are viral infections like influenza, smallpox, and chickenpox, allergic diseases, and chronic myeloid leukemia. And penia occurs in corticosteroid therapy, drug-induced reaction, and acute pyogenic infections. Now, lymphocytosis. It refers to the increased number of lymphocyte count. The pathologic cause are chronic infections like tuberculosis, hepatitis, and whooping cough, viral infections like chickenpox, autoimmune diseases like thyrotoxicosis, and infectious mononucleosis, lymphatic leukemia. That is, here you can see the count is more than 10,000 per cubic meter of blood. And lymphocytopenia, when this refers to decreased lymphocyte count below the normal. These the causes are when patients on corticosteroid therapy or immunosuppressive therapy, hypoplastic bone marrow, or widespread irradiations, and acquired immune deficiency syndromes. The drugs that may produce leukopenia are antimetabolites, barbiturates, antibiotics, anticonvulsant, antithyroid drugs, arsenicals, and cardiovascular anti-neoplastic drugs, cardiovascular drugs, and diuretics, analgesics, anti-inflammatory drugs, and lastly heavy metal intoxications. Now discuss about monocytosis. Monocytosis usually raises the blood count above the normal 600 per cubic meter blood. The causes are certain bacterial infections such as tuberculosis and syphilis, and acute bacterial endocarditis, some bacterial infections and protozoal, and some rickettsial infections. And monocytopenia usually decreases the count of monocyte below normal. The causes of monocytopenia is very rare. It may be seen in hypoplastic bone marrow disease. So that's all for today. Thanks for watching.